Hi, and welcome back to Hey Doc, What's Up? We've been doing our series on migraines and the multiple causes and the multiple things that you can trial with your doctor to figure out if you can get on top of your migraines, which is going to help you with what their root cause of that migraine really are. So we've talked about hormone, we've talked about TMJ, we've talked about whether or not there may be a muscular imbalance that you may require Botox. But one of the things that is another muscular overuse pattern that doesn't really respond well to Botox, but is a micro tear in muscles, are trigger points. Now, most people have heard about trigger points that you go to a massage therapist and she says, I feel a knot as you're getting a massage. Well, that's a micro tear in the series of muscle fibers that you have. You get a tear, and that tear in that muscle is something that is causing pain because A, it's pulling differently. Number two, it may have a nerve entrapment in it, and that nerve entrapment may cause numbness as well as pain. But if you have migraines, you may have muscular knots along the same distribution that we talked about medical Botox in our last talk, and that's along the mastoid process and along the occipital ridge along your skull line. And those are muscular tears from your sternocleidomastoid, the big muscle in your neck that when you tense, when you get really anxious or you're really working hard on a problem, you know you clench your teeth, which may cause a TMJ, but you also know or now know you may cause muscle fraying or micro tears that are going to start as early as your mastoid process and go backwards. So know that trigger points are not going to respond to Botox. Really, you don't want to paralyze a knot, then a knot stays a knot. Well, that makes sense, doesn't it? So instead, what you want to do is open that knot on a serial basis. As you open it, it will then heal, and if you can serially open it to the point where it's gone, it cannot re-tear unless you re-tear it. So if you're putting differential pull in areas, you may cause other muscles to therefore work harder, and that alone can also be a reason or a root cause for migraines, especially the temporal kind of migraine that many people get. So stay tuned next time we'll take a deeper dive into what again are trigger points and what do we do about them. Right here at Hey Doc, What's Up?